how much light you're exposed to during the daytime strongly influences the effect of small amounts of light exposure around the sleep period, such that when people spend more time outside during daylight, they much better buffer themselves against nocturnal light pollution. So if you're somebody who wears blue blocking glasses in the 2 hours before bedtime and has been inside the entire day, then you should probably just get outside during the day and the blue blockers probably wouldn't be necessary for you. But as a rule of thumb, I generally suggest that people spend at least half an hour outside during the day, during daylight, and then reduce their exposure to light in the 2 hours or so before bedtime. So dim the lights if you have dimmers, switch off some lights.
You're listening to the Live Life Longer show with Dan Voss, where we discuss longevity, anti-aging practices, biohacking, having more energy, and living a happier, healthier life. In today's episode, I interview Dr. Greg Potter about the importance of sleep and how you might optimize your day to get the best sleep possible. Dr. Greg Potter's work at the University of Leeds on sleep, diet, and metabolic health was featured by the likes of the BBC World Service, the Washington Post, and Reuters. Greg has a BSc and an MSc in Exercise Physiology from Loughborough University, where he coached a sprinter to 4 gold medals at the European Championships. Greg has also worked with groups such as the United States Naval Special Warfare Command on health and performance optimization. Today, he spends most of his time working on Resilient Nutrition, a company he founded with his good friend Ali. Before we get into today's episode, I'd like to take a minute to talk about Kion, an awesome company that provides natural supplements and clean coffee for vibrant health. I've been enjoying their delicious coffee, which is in the top 3% of all coffee grown worldwide that can claim to be specialty grade. Their beans are tested by an accredited global organization to ensure that they're free from yeast, pesticides, mold, and mycotoxins. Kion coffee is ethically sourced, it's roasted to maximize health and flavor, and packaged for freshness. To get 15% off your order of Kion coffee or any of their products and supplements, visit getkion.com, that's getkion.com/Dan Voss, and enter code Dan Voss, that's DANVOSS, at checkout for 15% off your order. Greg, thank you so much for joining me today.
Thank you very much for having me.
Yeah, absolutely. I'm excited to discuss sleep and sleep hygiene and how to get better quality sleep, not just enough sleep, but better quality sleep. And I know it's something that my audience is going to be interested in learning more about. I do find it's a topic that comes up quite a bit in a lot of my interviews, but not necessarily something that we dive into on a deeper level like we are today, where it's a whole episode designated to sleep. But that's what's so interesting to me when it comes to health, is that everything's interconnected. You know, if you look at nutrition, you look at exercise and sleep, you know, you need all 3 of those components to kind of mesh together nicely. And you need all 3 of those working properly to really optimize your full health. So I think that's probably why I have traces of that conversation in a lot of different conversations that I have. But again, I'm excited to have a full hour to sit down with you and talk further about sleep.
Health is a bit like a stool with several legs, isn't it? And one of those
Right.
legs, and if you remove any of them, then health deteriorates.
Exactly. That's exactly right. So why don't we give my audience some more context into how you got to where you are today, you know, how you got interested in the topic of sleep and decide to focus on it in your career.
When I'm asked this question, I always wish that I had a more interesting backstory. But my interest in sleep came about through a long-standing interest in all things health, and specifically how lifestyle affects how we feel and function each day. That began when I was 12. I hurt my back playing rugby, which coincided with a time at which I became interested in girls. And I started going to the gym off the back of that to rehabilitate my injury. But that also spawned an interest in sports nutrition. So between the ages of 12 and 20 or so, I mostly focused on learning about those. Studied exercise science at Loughborough University for my undergrad. After that, had a brief stint in professional rugby, and then went back and did a master's in exercise physiology at Loughborough. And it was during my time at Loughborough that I became increasingly interested in biological rhythms and sleep. That interest was mostly sparked by listening to podcasts with people who knew a lot about sleep.
Mm-hmm.
The more that I learned about sleep, the more fascinated I became by it. And halfway through my master's, I started looking at PhD options and found one at the University of Leeds, which focused on the intersection between sleep, nutrition, and metabolic health. So I signed up for that. Fortunately, I got the position, and the rest, as they say, is history. And nowadays, I wear a few different hats. My main hat is working as co-founder and chief science officer of a company named Resilient Nutrition that makes food products designed to help people feel and perform better sustainably. But I also act as a consultant, helping people with their health and performance. I sometimes help people specifically with their sleep, and I do a fair bit of this type of thing, also doing some public speaking too.
Very cool. And that kind of goes back to my point of how those, I mentioned the three big components of health is exercise, nutrition, and sleep. The fact that you have resilient nutrition, that just goes to show that the two are correlated and they're both needed, in addition to exercise as well. So that just, I was aware that you had that going on, but it just kind of furthers the point there. Yeah, that's cool, man. So why don't we just start off a little bit, go in a little bit further on why sleep is important. Why do we sleep to begin with? Why is it so important for our health?
Why do we sleep is a question that has troubled researchers for quite a long time.
Mm-hmm.
And people have come up with various theories as to why we sleep. Simplistically, we can think about sleep as being the price that we pay for wakefulness. And it doesn't make too much sense to think about sleep without considering it in relation to wakefulness.
Mm-hmm.
If we look at different animals, then we can gain some clues as to the functions of sleep, because there are certain processes that sleep is involved in those different animals. And across many animals, there are various different things that seem to predict sleep need, that include things like the type of diet that the animal consumes, the complexity of their nervous system, and a few others. But I think if you consider everything that your body needs to do, then those processes are taxing, and sleep serves as a period of adaptive inactivity in which the body can restore some of those processes, but also integrate some of the information that it's learning about the world and model how things might change in the future. And if you look at sleep, then it's not some monolithic entity. We have different stages of sleep, and both our duration of sleep and our timing of sleep and our sleep architecture, so those different stages and how much time we spend in each of them, change across the lifespan. So it's probable that sleep also serves slightly different roles across the lifespan. So, for example, in infancy, there is a preponderance of rapid eye movement sleep, which is the stage of sleep in which we do most of our dreaming. And at that stage, it's probable that much rapid eye movement sleep is critical to the development of consciousness. Then, as we progress through our childhood, sleep becomes more consolidated. We sleep progressively less over the lifespan. Sleep shifts later until around the end of adolescence. And we also, of course, start spending more time in other stages of sleep relative to the amount of time that's spent in REM sleep early in life. So if we focus briefly on those different stages of sleep, then when we first fall asleep, most of us will enter non-REM sleep stage 1. And this serves as a bridge between wakefulness and sleep. We then enter stage 2 sleep, which is the stage of sleep in which we spend most of the night. And interestingly, as an aside, when people take sleep drugs, they tend to lead to a preponderance of time spent in that particular stage of sleep. And that's important to things like learning. And then from there, we go into the deeper stage of sleep, which means that it's hardest to wake somebody up from that stage. And this seems to be very important to physical restoration. So during this stage, our bodies synthesize the majority of the growth hormone that they produce over the course of a 24-hour day. And this is important to remodeling of connective tissue, for instance. Slow wave sleep is also very important to the consolidation of memories and probably to memorizing specific facts in particular. And then it's also during this stage that our brains undergo much of their waste disposal. The longer that we've been awake, the greater the accumulation of various metabolic byproducts that need to be cleared out of certain parts of the brain. And during this stage of sleep, there are these high amplitude, so-called slow waves of electrical activity that are strongly synchronized with each other. And interestingly, these lead to changes in blood flow. These changes in blood flow subsequently lead to changes in the flow of fluid through what's named the lymphatic system, which is like the brain's immune system. And during this stage of sleep, the space in that system opens up. So these slow waves lead to changes in blood flow that leads to changes in that fluid, which pushes some of the metabolic debris out of the brain. And that debris includes things like beta amyloid, which is implicated in the pathogenesis of Alzheimer's disease. And then from slow wave sleep, we typically go back into stage 2 sleep before going into rapid eye movement sleep, which is sometimes named paradoxical sleep. The reason that it's named that way is because whereas parts of our brains during that stage are more active metabolically than they are during wakefulness, if your sleep is healthy, then most of your muscles, your non-essential muscles, so not your heart, but your skeletal muscles, will be paralyzed. And the reason for this is probably to stop us from acting out our dreams. And it's a very strange stage of sleep in some ways. Body temperature regulation goes out the window. We do most of our dreaming during this time, which seems to serve a few different purposes. One of which is probably related to our regulation of emotions, but also it serves as a sort of space in which to try and make sense of the world, a safe environment while our bodies are relatively disconnected from the outside world, to integrate different sources of information, try and make new connections between things. And interestingly, if you look at research on REM sleep and learning, then this stage of sleep seems to be very important to understanding the gist of things. So if you're taking a multiple choice questionnaire test, it'll probably be this stage of sleep which would be most helpful in helping you identify the right answer when you don't know it, but you've got an inclination that's probably one of those. And we then go back into one of the lighter stages of sleep typically, and we'll go through these cycles roughly every 90 to 110 minutes over the course of the night. And 18 to 64-year-old adults probably go through something like 4 to 5 of those cycles each night. And we do most of our dreaming at the end of the sleep period. And the proportion of time we spend in that stage of sleep is about a quarter, and the proportion of time we spend in the deeper stage of sleep is about a quarter.
Okay.
And that's over the lifespan such that in later years, people typically spend less time in the deeper stage of sleep. And as an aside, when people intervene to try and enhance that stage of sleep, they may offset some of the negative consequences of aging. So that was a very circuitous answer, but you touched on a few things in there.
No, that's super great. I think for a lot of people that are listening, especially for myself, I notice like the next day when I have a good night of sleep, the next day when you have more energy or better cognitive function, you know that it's from getting good sleep, but you don't know exactly like the science behind it or some of those different stages of sleep and why it's important. So that's very helpful. In terms of dreaming, what, like, for if you wake up the next morning and you remember a dream, is that important? Is that like, what does that signify?
It's a great question. So there was a dearth of research into dreaming for quite a long period of time, and recently there's been a resurgence of interest into dreaming, in particular into things like lucid dreaming training. And we don't fully understand dreams. I'll say that, and also specify that I certainly don't understand dreams. So as weird as they get. But if you look at different groups of people, then we can make some guesses as to some of the functions of dreams. And there have been various theories of them, from Freudian psychoanalysis to some more up-to-date ones, probably the best of which is put forward by some scientists at Harvard, Hobson in particular. And going back to the idea that the content of dreams differs according to different people, if you look, for example, at people who have insomnia, then they tend to report their dreams more often. They remember more of them because they wake up more frequently during the night. And interestingly, the content of their dreams tends to be more negative. And that has subsequent effects into wakefulness. So if you wake up and you've just had a fantastic dream, it's been really interesting and bizarre, fun or sexy or whatever, then you're probably going to feel better than if you wake up from a nightmare. And if we take an extreme example of that, then in post-traumatic stress disorder, it's common for people to experience nightmares. And what should happen during this dream stage of sleep is that the levels of two neuromodulators in the brain, adrenaline and noradrenaline, should be very low. But interestingly, during these episodes in PTSD, they often increase, and those promote alertness, and they can lead to wakefulness from those nightmares. The problem being that when people wake up from those nightmares, it's as if the brain doesn't get to fully process the contents of those nightmares. So if you think about an old school record player, it's a bit like the needle falling out of the groove each time. And so because they never complete the dream, same issues keep popping up, and that possibly perpetuates some of their problems. And some of the medications that are used to treat PTSD related sleep problems, such as prazosin, which acts on those neuromodulators, might be helping through that particular mechanism. Going to another group of people, insomnia specifically, there's been some fascinating research in recent times by a man named Jason Ellis, who's at Loughborough University, who's looked at lucid dreaming training. Lucid dreaming is something that about half of people will have experienced, in which they're conscious during their dreams. And this isn't specifically a criterion that must be in place for lucid dreaming, but some people can take control of those lucid dreams too. And the reason that they're conscious during them is just that when we sleep, there are some parts of the brain that can have wake-like activity. And in this instance, parts of the brain that are very important to consciousness can be awake, whereas other parts of the brain can be fast asleep. Hence that bizarre.
Wow.
And you can train somebody to lucid dream. So what Jason Ellis thought was, well, if these people who have insomnia and some related psychiatric problems, so depression and anxiety, if we can teach them to take control of their dreams and thereby make the content of the dreams more enjoyable, then maybe we'll have some effect on their subsequent daytime function. And he took them through a brief period of lucid dreaming training in which they kept dream diaries. That's at the cornerstone of trying to get people to lucid dream. They also did reality checks on the hour, every hour. They set an alarm, and what they did was when the alarm went off, they just looked at their hands and they asked themselves whether they were awake or asleep. And they also used a couple of other specific techniques. One of them is named auto-suggestion, the idea being that when we dream, there are sometimes some very odd things that come up in those dreams. And if we can learn to identify those in multiple dreams, then as we experience those in the dreams, we can cue ourselves to become lucid. And then they also did some visualization while they were in bed, imagining the kinds of dreams that they wanted to have. And what they found was that during this brief intervention, they did lucid dream slightly more frequently than they did at baseline, but they had a dramatic improvement in their insomnia symptoms and also experienced reductions in their depression and anxiety symptoms too.
Wow.
It seems that there are instances in which taking control of our dreams can have some therapeutic effects. And while it's not something that we fully understand, my guess is that in the future, as we understand this subject better, we're going to incorporate lots of different types of treatments from different approaches in a way which is personalized to the individual, such that we can leverage some of the beneficial aspects of each of those approaches. So maybe, for example, someone who has insomnia uses elements of cognitive behavioral therapy for insomnia, which we might touch on later. That's the frontline treatment for insomnia. Then also elements of metacognitive approaches that center on mindfulness and elements of lucid dreaming training, such that the whole package is better than any one of those individual parts would have been.
It's fascinating stuff. I think with lucid dreaming, it's something I never would have thought of, that you can actually have control over that, you know, and it's something that I find really fascinating because I like to talk about biohacking, and I know my audience enjoys that as well. And it's in a way kind of biohacking. You know, we might not know exactly the benefits of it yet, but the fact that we are aware of it is pretty neat. And it's definitely hopeful, I think, for the future in terms of new findings. And I guess with that, like, what do you see in the overall field of sleep? Do you see there's like tons of opportunity to learn and like discover new things about dreaming and sleep? Obviously there's so much content and information that is out there already that you're aware of and other experts are aware of, but what kind of opportunity are you seeing for the years ahead?
Well, I think there's a massive amount to learn. The field of research is in its infancy, and sleep is hugely heterogeneous. And I think this is often lost in these conversations. I find myself speaking a lot about things like insomnia because it's the most prevalent sleep disorder.
Yeah.
And if you go online and you look on social media channels, then you'll see listicles of sleep hygiene tips. And those are important and relevant to everybody. But what's sometimes lost is that there are all sorts of different sleep presentations, some of which we really don't understand very well at all. There are 6 broad categories of sleep disorders, for instance. There are things like circadian rhythm, sleep-wake disorders, everything from jet lag to shift work disorder, to some other intrinsic problems such as advanced sleep phase syndrome, delayed sleep phase syndrome, non-24-hour sleep-wake disorder. Then there are sleep-related breathing disorders, which have traditionally been the focus of sleep medicine. The most common of those is obstructive sleep apnea, which can lead to lots of nasty effects. What happens is that the upper airway intermittently collapses, leading to acute hypoxemia, increased blood pressure, frequent awakenings during the night, and all sorts of downstream consequences, including things like increased risk of traffic accidents, systemic hypertension, possibly increased risk of various cardiometabolic problems too.
Wow.
Then there are the insomnias, and insomnia itself is very heterogeneous. You have sleep onset insomnia, in which people struggle to fall asleep, sleep maintenance, in which they struggle to sleep through the night, sleep offset insomnia, in which they struggle because they wake up really early and can't get back to sleep. Then there are parasomnias, which are some of these bizarre experiences that people have, and these are non-REM parasomnias, such as sleepwalking, but then also REM parasomnias, such as REM sleep behavior disorder, in which the brain should paralyze the muscles to stop people acting out their dreams, but that paralysis never happens, and people act out their dreams, and that led to some very bizarre court cases over time. And then at the extreme, there are sleep disorders such as KLS, Klein11 Syndrome, which people know next to nothing about.
Mm-hmm.
Because in about one person in a million people, it's extremely rare. And every week to every few months, somebody will have a bout of extreme sleepiness, coupled with some quite odd behavioral aberrations. So when you look at that spectrum of different sleep phenotypes, it's fascinating.
Yeah.
And there's a huge amount to learn. And right now, the way that sleep problems are often treated is likely far from optimal.
Mm.
Think about a typical paradigm in which somebody walks into their doctor's office and has 15 minutes with their doctor, then it's likely that person won't be able to relay lots of information about behavioral interventions to support better sleep health and will instead reach for a prescription.
Mm-hmm.
Sleep drugs have lots of nasty side effects and, to be honest, aren't that efficacious for the most part. So in the case of insomnia, cognitive behavioral therapy seems to be at least as effective as the best sleep medications that there are, and it doesn't have the side effects. So there's a lot to learn. I'm not sure that I really answered your question there.
No, definitely. No, absolutely. I think that's exactly what I was looking for, is that there's already so much that we do know about, but just everything you've listed with the different types of insomnia, that segment alone is just like a ton of opportunity to find new discoveries and new solutions. So it's extremely helpful. What about like any other risk of not getting enough sleep or not getting good quality sleep? You know, how does it affect our mood? For people that struggle with their weight, how can that affect them? Injury risk, our fitness, you know, our cognitive function, we've talked about a little bit. Like, what are some of the main things you're seeing with health concerns when people are not getting good sleep?
When somebody doesn't sleep well, I'm not sure that any aspect of their biology goes untouched. And what you mentioned there is a few different aspects of what you might term sleep health. A lot of people focus on sleep duration and the consequence of short sleep, but there are lots of different dimensions of sleep health, each of which is individually important. And it's only in the last few years that people have tried to operationalize this. There's a terrific sleep researcher named Daniel Bicey who wrote a paper in 2014 about sleep health, in which he tried to provide a framework through which to approach sleep problems.
Mm-hmm.
And he came up with the acronym SATED. So one dimension of sleep health is satisfaction with sleep. Another is alertness, so our daytime function. Another is the timing of sleep. Anybody who has experienced jet lag will know how much disruption to sleep timing can suck. Then there is the efficiency of sleep, which is a marker of sleep quality. Sleep efficiency is the proportion of time in bed that somebody's actually asleep. If you think about sleep quality, there are lots of different aspects of it. There's how long it takes somebody to fall asleep, sleep latency. There's sleep efficiency. There's subjective sleep quality too. So if you look at insomnia, it's common for people to experience something named sleep state misperception, in which they will report the morning following sleep that they had 2 hours of sleep. And if you hooked up electrodes to their scalps, then you might see that they had 7 hours of sleep. And so what happened was, going back to that idea that parts of the brain can be awake, some parts of the brain were awake and other parts of the brain were asleep, such that they don't feel they slept well, but they actually probably slept better in a more restorative way than they might have perceived. However, their perceptions of their sleep quality will influence their subsequent daytime function. And then there is duration of sleep too, and how much sleep somebody needs is a moving target. I mentioned earlier that it varies across the lifespan from something like 18 hours a day in newborns to maybe 7 hours a day in elderly people. And it also varies on a short-term basis. So if you, Dan, for example, had been through a lockdown period in which you found yourself much more sedentary than normal, and then the world opened up again a bit and you began a structured exercise training program, you'd probably find that, at least initially, your sleep need increased in response to the exercise training. And you'd also find that you fell asleep faster, your subjective sleep quality would probably improve a bit too.
Yeah.
Sleep quality would be slightly higher. Then there's infection. If somebody has a mild infection, then it will typically lead to them sleeping more than previously. If, however, somebody has a severe infection, then the severe infection will often disrupt sleep. And people who have had COVID-19 might have experienced that if they had a bad bout of it.
Yeah.
There are those dimensions of sleep health. And importantly, each of those individually predicts risk of certain chronic diseases and all-cause mortality. So each of them individually will predict risk of coronary heart disease, for example. Somebody with lower sleep efficiency or short sleep duration will be more likely to go on to develop coronary heart disease. But if we think about sleep disruption in general and how it affects us, then we can go about it in the following way. One is that when we don't sleep well, it influences our behaviors and our decision making. When people sleep poorly, they're more likely to abuse certain substances. They're more likely to smoke, to drink, to take risks. They're more likely to have traffic accidents. And then there are the deficits in biological functions that people will experience. And these are specific to the particular type of sleep disruption. Going back to the idea that different stages of sleep are important to different functions, that makes sense. You mentioned body weight, so let's use that as an example. And given that a lot of people focus on sleep duration, we'll also use that as an example. If you take somebody and you restrict the amount of time in bed that they have, then on average, they'll consume something like 253 more calories each day.
Wow.
After sleep restriction. There was a meta-analysis published last year showing that. And interestingly, they probably won't burn any more calories. So the resting energy expenditure will be more or less unchanged. How it affects their exercise will have some bearing on that. Then there's the quality of food that they consume. Interestingly, the research showing that sleep affects appetite regulating hormones is a bit all over the place. One of the problems is probably that people haven't looked at the ratios between certain hormones. So there's a hormone that's primarily synthesized by fat tissue that acts as a signal of long-term energy status named leptin, which is important to all sorts of things from reproductive health to energy expenditure too. When people don't get enough sleep, maybe leptin goes down slightly, but the research isn't very convincing. Then there's ghrelin, which is a hormone that's produced by cells in the stomach that tends to boost food intake acutely. Some of the work has found that when people don't get enough sleep, ghrelin levels go up slightly. But overall, the studies don't tend to show that. But what they haven't really focused on is the ratio of those different hormones. So if the ratio of leptin, which tends to reduce food intake, and ghrelin, which tends to increase, it changes, then maybe that would have some bearing on it. With that said, one thing that does seem to be the case is that when people don't get enough sleep, they will experience changes in the patterns of activity in their brains, such that the frontal cortex, which is very important to things like decision making, communicates less effectively with other parts of the brain that are involved in things like how we respond to rewards, such that we're probably more likely to favor smaller, sooner rewards, like a delicious donut, than larger, later rewards, like a six-pack. So if you look at how people change their eating behavior in response to food restriction, they're more likely to gravitate to very energy-dense, palatable foods. And there was an entertaining study in which people, after sleep loss, went into a mock supermarket with about $50 and were allowed to buy whatever items they wanted. And after insufficient sleep, they bought more calories worth of food than after they were sleep replete.
Yep.
And then there is the metabolism of the foods that people consume. and somebody hasn't had enough sleep, they are less insulin sensitive, which tends to lead to worse blood sugar regulation as one outcome, which over time could manifest in prediabetes or frank diabetes for somebody who was previously healthy. And we also know that blood sugar regulation and insulin sensitivity is important to the development of certain neurodegenerative disorders too, such as Alzheimer's. And then if you look at research on weight loss, then it also seems that if you control for dietary intake, the number of calories that people consume, the macronutrition, so the portions of carbohydrates, fats, and protein, but you give one group of people sufficient time in bed and another group of people insufficient time in bed, then the people who don't get enough time in bed lose about the same amount of weight, but they lose much more weight as fat-free mass and much less weight as fat mass. And the first study that very convincingly showed that was published in 2011 by Arlet Nedelcheva, who I think was in Chicago, where you are. So that's another factor at play. And that's a controlled setting. It's not representative of the real world, but I suspect that's likely to be the case in the real world too.
Right.
Just in the case of body weight regulation and body composition, there are good reasons to think that sleep will have profound effects on those outcomes. And if you look at epidemiology, so the study of large populations of people, then it is also clear that people who report shorter sleep are more likely to go on to develop obesity. And one of the more recent meta-analyses on that subject found that the odds ratio of developing obesity was 1.45 in short sleepers. So they were about 45% more likely to go on to, well, they had 45% higher odds of going on to develop obesity than people who reported longer sleep.
Wow. I think everything that you just said, it furthers the point that I don't know why I have this fascination of like these three core pillars of health with like nutrition, sleep, and exercise. It seems like I talk about them quite a bit, but I've always believed that sleep out of those three is the most important. And I understand you need all three to live a healthy lifestyle. Like all three are important. It really shouldn't be a discussion of what's more important than the other. But I do believe if you don't have good quality sleep, to your point, you're going to make worse decisions when it comes to your nutrition. You're going to have less energy to get the exercise that you need. So I do believe it furthers that point that sleep is arguably the most important out of those three.
Yeah, and I'm biased, but I think I'm probably on the same page as you. As somebody who studied exercise and nutrition academically too.
Yep. And again, sorry, go ahead.
No, I was just going to say, like you say, if somebody hasn't slept well, then their exercise performance will be impaired. If somebody exercises, then how they adapt to that exercise will likely be impaired too. You mentioned earlier injuries. If you look at adolescents and how they sleep and their risk of going on to develop injuries, then sleep is certainly among the strongest predictors, if not the strongest predictor of subsequent musculoskeletal injuries in people. Then if you think about the number of days that you can spend exercising, then that's dependent on things like immune function. And immune function is strongly affected by sleep duration and sleep quality. I think most relevant to this, there have been some studies looking at how people respond to vaccinations when their sleep is either experimentally manipulated or just monitored. And what you find is that when people report less sleep around the time of vaccination, their subsequent antibody response is dramatically lower.
Wow.
Such that some people will need an additional booster vaccine in order to bring up their antibody titers at a later date. So it's clinically very meaningful. And these things, of course, all interact like you say. So if you take somebody who's sedentary, you put them on an exercise training program that's appropriate for them, their sleep health will improve. If their sleep health improves, then that will have a knock-on effect on their food intake. So when we think about how to help people, the goal should be to identify the smallest change that somebody can do that's likely to have the largest positive effect on the desired outcome, while having the largest number of positive knock-on effects on other health behaviors.
Yes. I want to touch on that further, just in terms of like tactical advice on what we can be doing to get better sleep, improve our sleep hygiene, our sleep environment. Before we get to that, though, I just want to give a personal example. I'm living through a lot of what you just talked about, with, not getting enough sleep or good quality sleep. Just 2 months ago, I got a new puppy, and she's very much a puppy. She's been up several times a night. We're just turning the corner now, I would say in the last week or two, where she's sleeping through the night. But prior to that, it was a living hell. I mean, I was up every couple hours, and I need my sleep. I love sleep. And I was kind of smiling over on my end, because everything you were sharing, I can relate to it. I noticed I had lower energy. My productivity was way down. My decision making was not where I wanted it to be, especially when it came to food. I'm not somebody that would go and have a donut or something like that. But I found myself doing that, having sweets that I shouldn't be having. So it's just fascinating to think, everything you were sharing there, how much sleep impacts the next day in our decision making and our quality of life. So just wanted to share that personal story. So let's get into, because a lot of what I like to talk about is kind of biohacking stuff and like sleep hacks. What are some things you like to recommend for people to improve their quality sleep?
So I can touch on the sleep hygiene stuff that a lot of people are familiar with, as well as some other strategies, or I can touch on some of the slightly more esoteric hacking stuff, which does seem to be promising. I don't know which way you want me to go about it.
I'll leave that up to you, which direction you'd like to go. Maybe we can touch a little bit on sleep hygiene first, like in terms of what that is. Most people probably have at least heard the term, but why don't we just kind of briefly touch on what that is?
Sleep hygiene is a horrible term.
What do you prefer to call it?
Yeah, no, that's no criticism of you, Dan. It makes people think of dirty bed sheets, I think, and it
True.
really should be reframed. But when people discuss sleep hygiene, what they're referring to is a series of sleep permissive behaviors that people should be doing on a regular basis if they want to sleep well.
Mm-hmm.
Those include things such as not consuming too much caffeine too late in the day. As a rule of thumb, I generally suggest that people consume no more than about 3 milligrams of caffeine per kilogram of body weight, no later than about 9 hours before bedtime. For a 70-kilogram person, that equates to about 4 instant coffees or 1 strong Americano. Then there are other stimulants. Nicotine is among those. Interestingly, if you take a smoker and you have them abstain from nicotine, then their sleep tends to go out the window. And for those people, using nicotine patches can be helpful. But if you take somebody who's a non-smoker and you give them nicotine, then their sleep also tends to go out the window. So minimizing nicotine intake is helpful, and trying to wean people off it over time. Then there is the timing of nutrition too. And one of the more prominent effects of nutrition on sleep is that of alcohol. When people consume alcohol, they tend to fall asleep slightly faster, spend a greater proportion of the early sleep period in a deeper stage of sleep. But what happens is that alcohol is a muscle relaxant. So for people who snore or have sleep apnea, then the muscles surrounding the airway tend to collapse, exacerbating those problems. Alcohol also promotes diuresis, so people are more likely to wake up to pee during the night, and alcohol will hence fragment sleep. But when alcohol is metabolized, it's metabolized to acetaldehyde and then to acetate, both of which are actually excitatory. So late in the sleep period, people tend to wake up more frequently. And then if you assess their next day function, then of course it's going to be impaired off the back of drinking booze. So I don't want to be a killjoy, and I also don't want to stop people from having a drink now and then. But as a rule of thumb, capping intake no later than maybe 3 hours before bedtime is a good place to start. And the more that you drink, the earlier that you should drink. I always joke that the best time of day at which to drink is probably breakfast time. Then there are some other considerations too. So one is just the timing of the final meal of the day, specifically final calorie containing items of the day. I typically recommend that people consume calories no later than about 2 hours before bedtime. When people consume relatively fewer of their total daily calorie intake late in the day, they tend to affect their autonomic or automatic nervous system in a way that facilitates restorative sleep. Patterns of light exposure are very important to sleep too, and this gets a lot of airtime in the biohacking community. But I think one thing that's missed is that how much light you're exposed to during the daytime strongly influences the effect of small amounts of light exposure around the sleep period, such that when people spend more time outside during daylight, they much better buffer themselves against nocturnal light pollution. So if you're somebody who wears blue blocking glasses in the 2 hours before bedtime and has been inside the entire day, then you should probably just get outside during the day and the blue blockers probably wouldn't be necessary for you. But as a rule of thumb, I generally suggest that people will spend at least half an hour outside during the day, during daylight, and then reduce their exposure to light in the 2 hours or so before bedtime. So dim the lights if you have dimmers, switch off some lights otherwise. And then obviously you want to make sure that your bedroom is cool, dark and comfortable, stress-free, and your mattress should be appropriate for you. You want a mattress that effectively dissipates heat, and spring mattresses are generally much better at that than foam mattresses, because foam mattresses tend to store heat. And then also it's important to not exercise too late in the day. There was a systematic review published on the subject recently showing that exercise late in the day might not have very strong effects, but it wasn't necessarily that ecologically valid in my opinion, because when people exercise late in the day, it's commonly in the context of a gym in which you're exposed to loud noise, bright lights, and maybe you're lifting weights or doing cardio. And it's those combinations of factors that will push your sleep later and possibly impair your subsequent sleep quality. So typically recommend that people stop engaging in strenuous exercise at least 3 hours or so before bedtime. If it's moderate exercise, then maybe 2 hours before bedtime. And then transitioning from those sleep hygiene tips, and I think those are some of the more important ones, there are certain behavioral treatments that are used to help people who have insomnia that I think are very helpful. One of them is applying a principle named stimulus control of behavior. And people will be familiar with the name Ivan Pavlov, who is best known for his work on classical conditioning. Pavlov observed that when food was brought to dogs by an experimenter over time, the mere presence of the experimenter would lead the dogs to salivate. And so the dogs had learned to associate the experimenter with the presentation of food. The relevance of this to sleep is that when people are struggling with their sleep and have insomnia, they tend to spend much more time in bed hoping that they will fall asleep. The problem is that their brains learn to associate their beds with somewhere where they spend lots of time awake. And so they need to recondition themselves to associate their beds with somewhere where they're only asleep. That means saving the bed for sex and sleep only. It means only going to bed when actually sleepy. I don't care if you think 10 p.m. is the right bedtime for you. If you're not sleepy at 10 p.m., then you shouldn't go to bed at 10 p.m. And if somebody's been in bed for 15 to 20 minutes and hasn't fallen asleep, then they should get out of bed, do something relaxing in a different room in dim lighting, such as reading a book or doing a crossword or perhaps meditating. So stimulus control of behavior is really potent intervention for people who are struggling with their sleep. And I emphasize that for good reasons. I also think that some simple cognitive therapies that are used to help people have insomnia can be handy. One of them is scheduling worry time. I think a lot of people have a lot more to be concerned about in 2020 than in 2019.
Mm-hmm.
Look at sleep, then on average, sleep has probably shifted a bit later because people have more control over their schedules now. But sleep quality is deteriorated, and that relates to stress. And the idea behind scheduled worry time is that you block off, say, 20 minutes around dinner time in which to sit down with pen and paper and note everything that you're concerned about. You can do some problem solving at this time. You can also note the next thing that you can do to address that particular concern. And if there's something that you can't effectively act on as an individual, maybe that's the development of a vaccination, then that's fine. You just write down that you can't do anything about that right now. And that is best done not too close to bedtime, but also relatively late in the day, which is why I say dinner time. The reason being that a lot of people are very busy during the daytime, and that suppresses their concerns. And then as soon as they take their foot off the pedal, they have those concerns bubble up to the surface. And then another strategy that's very important for people to implement is to have a wind down routine. This is really obvious stuff, I know, but it's amazing how frequently people don't actually have a wind down routine, even if they have difficulties. And there are lots of different things you can do to unplug at the end of the day. But I think some of the most important are reducing exposure to light, like I said, around 2 hours before bedtime. I think that just having a hot shower or hot bath for 10 to 15 minutes is very helpful. And the right temperature is probably something like 40 degrees Celsius, if you were wondering. And the reason is that when people have a hot shower or hot bath, they'll raise the temperature of their skin, which will actually increase the gradient of temperature between their core and their skin, help them radiate heat out from their core, and that will help their brain temperature drop, which is important to sleep initiation. And there's been a meta-analysis showing that hot bathing around an hour before bed, if not slightly longer, does improve sleep quality and does help people fall asleep faster. Other things that are helpful at this time include listening to relaxing music. So no heavy metal or something quiet and relaxing. Classical music often does the trick. Being careful about your digital hygiene is hugely important at the moment. If you look at meantime and how it's changed over the course of recent months, and most people are spending much longer on their phones and devices. And when you think about screen time, it's a bit like nutrition in that there's good stuff and there's bad stuff. So if all the screen time was the equivalent of junk food, if it was just you doom scrolling through some feed about COVID-19 and how terrible the world is, then that's going to negatively affect your sleep.
Yes.
If the content was positive and it was you staying in touch with loved ones and feeling like you're socially connected, then that's completely different, of course.
Right.
But I think that as a rule of thumb, turning off screens, certainly turning off your phone at least half an hour before bed is a good way to go. And then leaving your phone out of your bedroom and not turning it on until you're up for the day the next day. And then otherwise, some practices to quiet the mind can be handy. One of them is simply breathing deeply through the nose using automatic breathing. That will affect the autonomic nervous system in a way that supports sleep health. Another is meditation. I think when people discuss meditation, there's a tendency to speak about it as if it's one thing. And meditation's a bit like exercise in that it can be very activating or somewhat relaxing. And I think as a general tip, body scan meditations are probably very helpful for sleep in the near term. And there are a few of those on YouTube that people can check out. I really like Mark Williams's body scan meditations. He wrote a book about meditation, which was the first book on meditation that I read, and I'm sure that's why I'm biased in that direction. But you actually want to do something somewhat familiar at that time of day. You don't want to do something which is too novel or stimulating. And then going from those tips to some more novel hacks that I think are interesting that aren't often discussed, I'll touch on a few. So first we have devices, and especially in the biohacking community, I think it's quite common for people to have bad relationships with their wearables.
Mm-hmm.
In the last few years, there's been an increasing number of people turning up at sleep centers with self-diagnosed sleep problems on the basis of data that their wearables are feeding them. And on objective assessment, they're absolutely fine.
Mm-hmm.
So people, they should just get rid of their wearables. And I think that's more likely to happen with the more common wearables, which are wrist or finger worn.
Yep.
And the reason is that these devices mostly rely on movement and assessments of pulse rate to estimate whether somebody's awake or asleep or in some stage of sleep. And to stage sleep accurately, you need to assess somebody's brainwaves, certainly at the moment you do.
Mm.
And so with that in mind, I'm not saying that they're not helpful. If you're somebody who just doesn't get enough sleep, you wake up to regularly, then they can help increase the salience of the fact that you're not getting enough sleep. And if you track your sleep duration over time using a wearable, then maybe that will nudge you into spending a bit more time in bed.
Mm-hmm.
They're also helpful at stimulating physical activity during the day. A lot of people, when they first wear them, will boost their step count because they find out that they're only taking 2,000 steps a day. But if you're using one of these devices to support sleep, then I think that the best device, my opinion, I don't use this product, I'm not affiliated with the company in any way, but I think it's probably the Dream 2 headband, which uses EEG to assess patterns of activity in the brain. Also has a triaxial accelerometer to assess movement, and that's cool in that it can tell you what your sleeping posture is. So when you're sleeping on your side versus your back versus your front.
Mm-hmm.
Assesses pulse oximetry, so it will tell you something about your heart rate, it will tell you about your respiration and your respiratory variability too. And if you look at the published data on it, then it seems to be very good at sleep staging and is therefore more or less unique among the wearables.
Okay.
The cool thing about this device is that it comes with an app that delivers cognitive behavioral therapy for insomnia, or at least takes elements of it to help people with their sleep, and it seems to be pretty effective. So that's one recommendation. The issue, of course, is that it's expensive. But if you're a biohacker and you've got a big budget and you want some sleep tech, then that's probably about the pick of the bunch.
What was the name of that again, Greg?
It's called the Dream 2 headband. Dream
Okay.
DREEM.
Got it.
Then if you want something which will more directly affect your sleep, then I think that the most intriguing product, or certainly among the most intriguing ones, is Ebb, which was developed by Eric Nofsinger, who's a heavyweight in the field of sleep research.
Mm-hmm.
And the idea here is that if you assess patterns of activity in the brain in people who have insomnia, then you see increased metabolic rate in their brain, and in particular in frontal brain regions. And that contributes to arousal around the time that they go to bed. Historically, cooling the brain has been used therapeutically in some instances, such as traumatic brain injury. And so Nofsinger thought, well, what if we just cool down the head in these people? So he developed this device, which is simply a pad that sits over the forehead that you can set the temperature of to cool down the front of the head. And he's published a few pilot studies, the most interesting of which were A, in a group of menopausal women, and B, in a group of veterans with PTSD, showing that when people use it over the course of several weeks, their insomnia severity drops quite strongly.
Wow.
They fall asleep faster and they spend less time awake during the night. And interestingly, in the menopausal women, they also have reduced menopausal symptoms, so your hot flashes. So I think that's really interesting sleep technology. Yeah. And then there are some other things that are more popular in the biohacking world that probably have some utility in this context. So photobiomodulation devices are quite widespread now. They're relatively expensive, but I think for people who have pain-related sleep problems, given the preliminary research that's out there, those might be helpful for some of those. Although there's been little research looking at the effects of red light therapy on sleep specifically. Van Sommeren published a paper showing that red light exposure, if anything, seems to facilitate sleep onset. slightly. Certainly, if you're going to expose yourself to light of any color around the sleep period, then red is probably best. It's the least disruptive to your body's clock. It's the least alerting.
Mm-hmm.
So there's that. And then finally, supplements I'm always asked about, and the biohackers will be curious about them. So I'll mention. We spoke about lucid dreaming at the start. And this is really esoteric, but I'm just mentioning it because it's interesting.
Yeah, no, please.
If you look at REM sleep, then during REM sleep, the levels of brain chemicals change, like I mentioned. And one of these in particular is acetylcholine, which is very important to things like learning and memory.
Mm-hmm.
And it increases during REM sleep. So agents that you can take that boost acetylcholine signaling would plausibly increase the vividness of dreams. And there's been some work showing that galantamine, which is an acetylcholinesterase inhibitor, which is the enzyme that breaks down acetylcholine in the brain, tends to support lucid dreaming. So by inhibiting the enzyme that breaks down acetylcholine, there's more acetylcholine left in the synapse, so more acetylcholine signaling, subsequently lucid dreaming. Now, that's very esoteric. Something that's missed when people discuss sleep supplements is that the best sleep supplements depend on the sleep problem that somebody is struggling with. People think, yeah, take magnesium for sleep or take this for sleep. And that's not the right way to think about it. You begin with the sleep issue. Just as an example of this, people who have a sleep-related movement disorder named restless leg syndrome have dramatically increased risk of certain neurodegenerative diseases such as Parkinson's, dementia with Lewy bodies. And that often relates to disordered brain iron metabolism and dopaminergic activity. And because of that, when they supplement with iron appropriately, they can dramatically improve their symptoms. For you and I, Dan, if we supplemented with iron, it would do absolutely nothing for our sleep. Right. It would probably be bad for our metabolic health because it would potentially lead to some cardiometabolic issues. But if we put that type of extreme to the side, then if somebody's struggling to fall asleep at the start of the night, then I think that melatonin can be helpful. The right dose isn't exactly clear. It's probably between 300 micrograms and 5 milligrams. Smaller doses are better at shifting the timing of the body's clock. Melatonin acts in the body as an internal signal of darkness, so it's especially helpful during jet lag because you can time it to help you overcome jet lag faster in some instances. And if people want to understand when to best take it, there's a website named jetlagRooster.com that people can check out because it will help them with their patterns of exposure to various time cues and thereby help them get over their jet lag faster. And it will also give specific guidance about when to take melatonin.
That's cool.
Higher dose of melatonin might support metabolic health in people with poor metabolic health. And this was actually a subject of one of the chapters of my PhD thesis. Specifically, there's been some work looking at people who have metabolic syndrome and diabetes, showing that when they take quite high doses of melatonin, they might reduce markers of oxidative stress, they might reduce their blood pressure, and there's some evidence that it could also improve glucoregulation a little bit. That's melatonin. The safety profile is very good. One issue is that lots of the supplements that people buy off the shelves are contaminated. As a generic recommendation, I think life extension products are very good. They're rigorous with their testing and they perform very well in third-party tests. Again, no affiliation with them whatsoever. I just like what they do.
Sure.
And if somebody's struggling with their sleep because they feel anxious, anxiolytic agents can be helpful. L-theanine, dosed at 200 to 400 milligrams around an hour before bed, might be a good option. And L-theanine is just a non-dietary amino acid that's found in abundance in tea that has some calming effects through certain neuromodulators. I think KSM-66 ashwagandha could be helpful. 300 milligrams twice a day is probably the right dose of that. The cool thing about KSM-66 ashwagandha is that it does seem to be good for certain other things too, so it might enhance adaptations to strength and power exercise, and it might also boost cardiorespiratory fitness, as well as having some pro-cognitive actions. I wouldn't take any of these for more than 12 weeks or so at once, but they're all safe, it seems, out to at least that long. Then there are certain things that we consume in our diets on a regular basis that some people don't get enough of. If you look at US adults, then something like 68% probably don't consume enough magnesium. And magnesium is often discussed as a sleep aid. The research on magnesium in sleep isn't very convincing. But given that most people don't consume enough of it, and given that when they consume more of it, they tend to experience lots of beneficial effects, including improved blood pressure, blood sugar regulation, I wouldn't really hesitate to recommend it. The only potential downside is some GI distress. There was a study published recently on magnesium L-threonate, which was very interesting. L-threonate might be slightly better at entering the brain, and brain magnesium levels influence how responsive the brain is to certain neuromodulators. So interestingly, brain magnesium levels are actually substantially higher during the sleep period than they are during the daytime.
Interesting.
So possible that supplementation could support that and thereby support sleep. That's magnesium.
Do you have any foods that you recommend that are high in magnesium, or do you just recommend supplements?
Yeah, that's a good question. There aren't normally foods that I recommend. The issue is that the micronutrition of foods is so variable. Whereas if you take a supplement from a reputable brand, you have a better idea of how much magnesium is actually in it. So
that makes sense.
It might make more sense to go about it that way. And then just to close out some of those thoughts, if somebody's struggling with their sleep because of pain, there is an analog of an endocannabinoid named anandamide, and the analog is called palmitoyl ethanolamide, PEA, that seems to help reduce pain and neuropathic pain in particular, and thereby sleep if your sleep is disrupted because of pain. There was patients who have carpal tunnel syndrome showing that they slept better when they took 600 milligrams of PEA twice a day.
Interesting.
That's one option for those people. And then going to foods that seem to have positive effects on sleep. The most convincing evidence is for tart cherry juice, and different doses of that are used because in some studies they use a concentrate of it, and in others they use regular tart cherry juice. So the right dose is probably anywhere between about 60 milliliters and 500 milliliters, depending on the form that you use. Tart cherry juice contains a substantial amount of melatonin in it, and that might be one mechanism by which it affects sleep. Melatonin is relatively ubiquitous among living organisms, and it's present in lots of plants too, so it's no great surprise. But the nice thing about tart cherry juice is that there's surely minimal risk of adverse effects, and it does seem to support general health too. When people consume it regularly, they tend to reduce various markers of oxidative stress. It seems to support recovery from exercise. If you look at changes in muscle function following damaging exercise, for instance, then muscle recovery tends to be accelerated when people consume tart cherry juice, and muscle soreness tends to be lower too. And then the other foods that have been studied include things like kiwis, pretty esoteric. Wouldn't necessarily recommend it, but if you want to try it, then go for it. Tomatoes are another one. And then also certain types of milk. So I mentioned that melatonin is ubiquitous, and obviously other animals produce it too. And if you take milk from a cow during the nighttime, then the nighttime milk will contain melatonin.
Interesting.
Nighttime milk might have some influence on sleep via that melatonin that's present in it.
Interesting.
So those are some of the foods and supplements that plausibly have some bearing on sleep. But just to make this very clear, the important stuff is the behavioral stuff. And I know that I've just given a long list of different things that people can do. Is try one of those things. Try something that you think that you can do. If it seems too hard to do it, then think of a way to make the habit easier and also reduce the actual thing that you're asking of yourself to the smallest viable option.
Yep.
Give that a go for a period of time. You can monitor your sleep and understand whether it's positively affecting your sleep, or if you're somebody who's excessively focused on monitoring sleep, then you can do away with your wearable, but get some subjective sense of whether you think it's helping out or not.
Yeah. I'm a big fan of that in general. Is, obviously you just gave a whole bunch of information, lots of tips for people to try. I'm a big fan of that in general when it comes to health. Is, we know of all this stuff that we can do. You don't have to do all of it overnight, literally. Just take one of the examples you just gave, try it out for a week, see how it affects you, see if it improves your sleep. And then if that works, then keep going with it and try another one. You don't have to do everything all at once.
Yeah, and just to give people a couple of directions for changing their behaviors too. I think among the popular press books that are out there, Atomic Habits is one that people find very helpful.
Mm-hmm.
I wrote it in science, but he's good at taking some of the ideas that are grounded in science and then translating them in a conversational style that's easy to understand and relatively easy to implement. And of the scientists that are out there that work on this stuff, there's a lady based here in London named Susan Michie. Her surname is spelled Michie, who in my opinion is the world's foremost expert on behavior change. She has what's named the behavior change wheel that helps people identify appropriate behavior change interventions. And to give you an idea of the number of options that are out there, I think there are at least 93 different behavior change techniques that are included in it, and people self-monitoring or whatever it might be. But the best strategies are very much context specific. So in discussions like this, we can give people some pointers.
Mm-hmm.
Please recognize that this is something that you need to play around with. And having an attitude of experimentation and having fun with this stuff is important. I think that's one thing that biohackers get right. When I help people with their sleep, we'll do a series of mini experiments. We can try something for a period of time and try and help that person put a scientist's hat on and treat themselves like a study subject. And it makes it fun and engaging. And I think thereby makes it more likely that people will actually stick to the habit. If not, and the habit doesn't work, just try something different. I was listening to a podcast yesterday with a man named BJ Fogg, who's very well known in the world of behavior change because he was behind Instagram and some of the other very addictive technologies that are out there. When I say he was behind them, what I mean is that some people who he taught leveraged some of his ideas to help make those social media channels very sticky. So like BJ whatsoever. But he was saying that you can think about forming new habits in the same way that you can think about growing plants. There are certain plants that grow well at certain times of year in certain conditions and others that don't. And it might be that the plant you're trying to grow right now isn't in the right conditions, but if you try a different plant, then it will blossom.
Interesting. I love that analogy. You just gave us a whole bunch of information. I do want to ask one more thing before I get to my last couple questions here. You talked briefly about breath work for those that are struggling to fall asleep. I just started within the last few days mouth taping. Have you experimented with mouth taping? It's something you recommend?
It's not normally something that I recommend. I haven't personally experimented with it because I'm a nose breather, so I haven't needed to.
Mm-hmm.
I think that the concept makes sense, and I've heard lots of positive anecdotes about it. Most people who mouth tape do so with a view to learning to breathe through the nose, and most people who are breathing through their mouths want to address that because they're snoring and maybe they're disturbing their bed partner with a very dry mouth and experiencing some problems related to mouth taping related to breathing through the mouth, sorry.
Mm-hmm.
Look at the research on snoring, then jaw repositioning devices are generally the first line treatment. So specifically, using a device that advances the jaw, shifts it forward, tends to open up the airway, help people better breathe. So I just add that for completeness. But I do think that learning to breathe through the nose most of the time, not necessarily all of the time, makes a lot of sense.
Mm-hmm.
I know that there are certain people who have discussed this at length in recent times. James Nestor,
Mm-hmm.
McGowan, and some others are among people who have popularized the idea. But I haven't come across any research on mouth taping per se. I also haven't looked for it. So it might be out there.
Sure.
If it's helping you, then I say go for it, because mechanistically it makes some sense. And regardless, I think that learning to breathe through the nose is bound to be good for you because of its effects on the nervous system and because your nose is better at filtering particulate matter and so on.
Yeah, it's something I'm experimenting with more, especially during the day. But I've noticed, at night I wake up in the next morning with a dry mouth, and so I figured it was something I'd give it a try and see if it helps at all.
Wow.
Very good. I want to be respectful of your time here. You've given so much awesome information. Before I let you go, where can people learn more about you and your work?
So the place that I'd like to direct people is resilientnutrition.com, but we currently are only based in the UK.
Mm-hmm.
We can ship products throughout Europe. Hopefully we'll be in North America relatively soon. And with that said, one thing that I'm really keen to do at Resilient Nutrition is share helpful information. It's not just about selling products.
Mm-hmm.
And to that end, I recently wrote an ebook named The Principles of Resilient Nutrition. It touches on some of the things that we discussed today, but goes into quite a lot of detail about the principles of healthy nutrition that people should abide by regardless of their dietary preferences, whether they are carnivores or vegans. These principles are relevant and include things like the importance of diet timing and how to best go about when you eat for your particular context. So if people sign up at resilientnutrition.com, they can download that ebook for free. So I'd say check that out. And then otherwise, I am on social media. I'm trying to be more active and I'm trying to share helpful information about sleep now. So I'm currently doing a series of sleep tips that touch on some of those things that we discussed today. And my handle is at Greg Potter PhD, which is just a terrible handle. Sounds so self-indulgent, but at Greg Potter was taken. So I figured I'd try and distinguish myself somehow. I also have a website, which is gregpotterphd.com. I desperately need to update it. It's awful. Don't go there.
Well, I will have it all linked up in the show notes in the description for people that want to check out your social profiles and your website. Very cool. So my last question I have for you here is, why do all of this? Why is health important to you? Why talk about sleep and nutrition? Who is it that you want to impact the most with the work that you do?
I love that question. Why do it? I suspect that the answer that you always receive is because people want to positively affect the lives of as many people as possible.
Yeah, it's a common answer.
Yeah. So if I said that, I would just feel like a banal, broken record. that is the reason at its core.
Mm-hmm.
But I suppose that there are other reasons too. And I think at this stage in my career, I'm relatively young. I'm 31, and I'm trying to build a foundation from which to help lots of people. And I think there are lots of ways that people can go about that. So for me, I do this type of science communication because hopefully people find it interesting and it sparks their interest enough that they try something and they find it helpful. And then maybe they go from there and go on to lead healthier lives that are more fulfilling too. They get more out of the years in their lives, and maybe they add a few years to their lives too.
Mm.
But with that said, I think there are lots of ways through which we can help people. And so one thing that I really liked to do over the course of my career is to give back in other ways too. I'm a huge fan of the effective altruism movement, which was popularized by Toby Ord and Will MacAskill. And I read the book Doing Good Better shortly after it came out, which is just about how you could do the most good possible. And I think people who are intrigued should definitely go and check out that book. And they're both involved in a related project named 80,000 Hours. The idea being that on average, we spend about 80,000 hours of our lives at work. And we should therefore think very carefully about how we spend those hours if we want to positively affect as many people as possible. And Toby wrote a book named 80,000 Hours, which I think is available for free as a PDF online. So I'd definitely check that out too.
Cool.
And finally, one of the things that they suggest is giving a fixed proportion of income, if you're in a position to do so, to effective charities over the course of your life. And to be transparent, I don't currently do that. I do intend to do that at some point. And one thing that we do at Resilient Nutrition is I was insistent that we donate a fixed proportion of our sales to an effective charity. And I'm a bit of a dirt worshipping hippie. I love nature, and I've been very fortunate. I spent a long time in many very beautiful places, and I'm desperately concerned about the preservation of those places. The charity that we chose is the Coalition for Rainforest Nations, which works with governments and communities in various tropical countries to help those people protect their rainforests and thereby preserve biodiversity and help mitigate climate change. So
I love that.
I'm trying to go about helping people, but that of course is the core thing that I'm trying to do while having fun along the way. And that is important because I'm hugely fortunate in that I do love what I do. And I know that that's not the case for lots of people, so I don't ever want to take that for granted. And having worked in roles that I love doing now for a few years, I can't imagine ever doing a job that I wouldn't enjoy. So doing something that means something to me, I feel like I'm occasionally half decent at, and that puts a smile on my face is very important too.
100%. I love that, man. This whole conversation I've really enjoyed. I truly mean that. And every once in a while I have a guest that I know I want to have back on, and I feel like there's a lot more that we haven't covered when it comes to sleep and nutrition. And I didn't realize you're big into nature. I am as well. So maybe if you're generous enough with your time, I can have you back on in 6 months or a year, and we could even talk about nature, because there's so many health benefits to being in nature. You know, there's one conversation you can have about the importance of preserving our nature. But what I'm starting to get into is the health benefits of spending more time in nature, which is where we're meant to be. So
I normally start conversations there. I think it's worth thinking about our lives in the context of evolution. You think about the discussion that we've had today, then organisms evolved on a planet in the presence of predictable changes in the environment. The Earth rotates about its axis, creating the 24-hour light-dark cycle.
Yep.
To thrive in this changing environment, organisms evolved their own biological clocks that produce biological rhythms in their biology and hence behavior to optimize their activities according to time of day. And the problem is that nowadays, the third clock, the social clock, influence our lives more and more. So we now have a 24/7 society that conspires to disrupt our clocks and thereby worsen our health. And if in our modern environments we can better mimic aspects of the environments of our ancestors, which of course includes being part of the natural world as opposed to being apart from the natural world, then we will all benefit in the long term.
I love that. I think after hearing all of that, we need to have a separate recording just on that topic, because it's fascinating stuff, and it's stuff that we need to have more conversations around that topic, living how our ancestors lived. Because I think in today's world, the digital world, like you said earlier, like there's, I think you're talking about like being on our devices before bedtime. There are certain applications of technology that are good. We're using technology right now, right? Like if you FaceTime with your relatives, especially during COVID, like that can be a good thing. But we're seeing so much overuse of social media and being on email and scrolling through the web, and it's a little scary in many ways. And I'm just happy you're interested in it and you're willing to talk about it. So cool, Greg. I appreciate your time, and thanks again for coming on the show.
Pleasure. Thanks so much, Dan.
All right. Thanks. Have a great day.